Our next panelist is Dr. Nisha Rughwani. Dr. Rughwani has trained in the United Kingdom, where she went to medical school and pursued a residency in family practice. She moved to the US and came to Mount Sinai about 4 years ago, where she pursued a fellowship in geriatrics. Since April of 2007, she has been an assistant professor of geriatric medicine at Mount Sinai Hospital. In addition, Dr. Rughwani sees patients at the Martha Stewart Center for Living at Mount Sinai Hospital. Welcome.
Good morning, and thank you to the Commissioner for a great welcome, and to my co-panelists for, the fun for putting all this together, where it's extremely important. I'm going to actually bring you back to the client, who these people are that we're taking care of, and who desperately need some of these services. It's interesting to hear as a physician of all these different alphabet soup of, different things that are available out there. I want to give you a little bit of a background of my practice and kind of what our setup is, to understand kind of how fortunate we are, but how many physicians out there really aren't, and how some of these great services, in addition to having more of them and continuing to provide them, is how do we bring that to the attention of single providers, physicians who may not know about some of this. So I work at Mount Sinai, and we have one of the largest geriatric departments in the country. We have a lot of providers. We have in our practice nurse practitioners who work alongside us, and we're very fortunate to have 4 social workers who are also care coordinators in our practice. And one of them is here today, Faye Kahan, who's going to kind of help later answer any questions from a much more kind of on the medical field level. So we're very fortunate. When I see a patient or a client and they have, in addition to medical issues, the great thing about a geriatrician is that we get to see not just the medical issues, but the social aspect of their kind of well-being and living, which is very, very important and plays a phenomenal role in how well they do and their outcome. So we have care coordinators and social workers who help us with this. So when I have a patient who has a problem, I'll refer them to the social worker or care coordinator, say, these are their issues, can you kind of help us with the services and all this, all the things that may be out there. Just like everyone's goal, my number one goal is to have my patient or client out of institutions. I want them out of the hospital. I want us to try as much as we can to be well taken care of in the community from a medical, social aspect. Some of the things that really we see a lot of and that really require this kind of treatment are things like patients who have some kind of dementia, some kind of, they may not be completely mentally impaired, but may have some cognitive impairment. So they're unable to completely take care of themselves, but we don't want them in an institution. We want to try and maintain that as best as we can, provide the services that they need, mainly kind of just their day-to-day living and their safety. We see a lot of patients who fall all the time. So how do we have them in a community where they don't fall? How we can improve that? How can we, just like you said, there's lots of facilities out there with physical therapy and rehab, but they're not necessarily all at the same level. And how do we ensure that our patients and clients are getting the best of that? One of the things that you talked about, isolation, malnutrition, these are the things that we see a lot of. A lot of our older clients, will have some family support. A lot of them do not. They are alone. They have no one. And so we have to try and make sure that they're going to be safe in their environment, that they're going to be able to live at home, and that we know that they're well taken care of. They are not eating. They are not getting lost. They're not wandering on the streets. They're not, that they have somewhere to go to. It's interesting because this whole managed long-term care plans are great, and I'd love to, a lot of practices, there's insurance issues sometimes, and sometimes we can't see some of these patients. So these services are there and they're great, but the way that the payment works in some institutions doesn't always allow our patients or clients to be part of these, which tends to be a little bit of a problem at certain times. For us, what we see is, there's so much out there and it's phenomenal. Medicare has done, the best that it can. All these additional services have really protected our patients and cared for them. But we do see this subset of patients who, if they are on some of these managed long-term care plans, they can't come to our practice, for example, for different payment issues. Then we have patients who have Medicare, but they won't pay for home services. We have patients who don't qualify for Medicaid, so they're not quite there yet. So there's this big gap. It's, one of my panelists and I were talking earlier, it's almost like the donut hole. There are these group of people out there who need services in their home. They really can't pay for it privately, and yet they aren't able to be alone for most of the day, or they need help. They need help, there's Meals on Wheels and all these great other services to help with food, but they just need someone there to help bathe them, to make sure they're safe, to make sure they're not wandering. We're, again, very patient-centered practice. Everything that we do, it's really around the patient, and care coordination is extremely important. So when Catherine talked a little bit about kind of the care coordination and the importance of it within the different services, that's kind of the coordination within the services in the community, and that with the physician and their medical practices is sometimes, it's much improved than it was, but I think that's another care gap area where we kind of need to have a system where the physicians and the care providers for their medical aspects are kind of in that pool of people who have care coordination for these different patients. The senior centers, day programs, they have been a complete savior for a lot of our patients, and they're fantastic because it gives our patients somewhere to go during the day where they're safe, they have meals, they're entertained, they're not in isolation, they're able to communicate with other people, and they're all great. We just need more of them. We kind of feel that it really has helped a lot of our patients who have some kind of both physical and mental challenges to actually be in these programs, because it's really helped keep them safe and keep them also healthy, because they're having these things. Just like Catherine talked about, it is important. So in order to keep people healthy out of institutions, we really need them to have social interactions, physical exercise, and the other big thing, which a lot of these services try to provide, and I feel like there's definitely a much more increased need for, is the kind of mental activity and stimulation that clients and older patients really need to keep young, to keep healthy, to keep well. One of the things that, as a recommendation for some of the senior centers and day programs, is maybe even to have satellite doctor offices in some of these places, so that when they're there, if there's a problem, or having a physician or a nurse practitioner kind of keep tabs on on some of their chronic medical conditions, be it diabetes, hypertension, mental health, depression, any of those things. Again, these early signs and early pickups in the community is really what keeps our patients out of the hospital. If we know early enough that something's not quite right, we're keeping them out. They're not going to be admitted. They won't be readmitted. They will not be institutionalized as much. And again, there's evidence out there to show that if you can take care of these people earlier, you're really avoiding them from deteriorating and needing more services and institutionalization later down the line. A lot of our patients who attend day centers, adult programs, have dementia. So, and then there is a variation in dementia between mild, moderate, severe, and a lot of the mild, moderate cases of dementia tend to spend their times at home in day programs. And a nice thing about some of these day programs are that they are catered for that, but it would be really nice to actually have that almost in every program, where you can have a special area or special program designated for these people, because they may not really understand everything that's going on. Keeping them safe so they're not wandering. They need more help with their food. They need more help with understanding kind of what's happening around them. And that's something that we find some of our patients or clients have problems with. But the fact that these day centers and adult day programs exist have totally revolutionized some of the care that we can provide our patients. One of the biggest issues we find also that I see in my patients is kind of how do I keep them intellectually stimulated? And we have a large range of elderly people, as we all know, and it's not just where they live in socioeconomic class, but it also is literacy level and intellect level. So I think we're very good at trying to provide for patients who have good literacy, patients who have, or clients who have not just, they're of average socioeconomic kind of, average intellectual kind of capacity. And so if in some of these programs, there's some great lectures that are given and education, but they may not be necessarily attacking and helping those patients who are not very health literate. So trying to help those patients who really may not understand what's going on because they just don't have that education level to understand the simple education we're giving them about their chronic medical conditions. So maybe having certain programs to kind of help them help those patients. And then the biggest gap I also see is people who have higher intellect levels, so may have had highly functioning jobs prior to retirement, just getting bored because they don't want to necessarily play bingo or they don't necessarily want to do some of those activities, but they want to be involved in group discussions on book clubs or, on current affairs or things that are not necessarily offered. So I have a wide range of patients who come to me and say, well, where can I go during my day so I'm not bored and actually meet other people who want to have these discussions? There are lots of private opportunities out there, but again, not all of our patients and clients can really afford that. They're very expensive. And so even though these services are provided on a general level, I feel that there are these two spectrums of the population that are not always well taken care of, or there aren't enough services out there for them. The other important thing actually to talk about is elder abuse. So there is a lot of it happening. The numbers are still low, and the majority of the time we're very good at picking them up, but they're difficult. So Faye Kahan, who's here with me today, is also an elder abuse specialist, and so it takes a lot of experience, patience, getting to know the patients, getting to know the family structure, getting to know some of that, to know whether this is actually happening. And it can happen on all levels. It's a physical, it's an emotional, it's a social, it's a, it's amazing what happens out there. So trying to maybe pick that up a little bit more, because we're definitely seeing that. My talk today was centered on service gaps much more than what's out there, but there is definitely so much out there, and we're very, very thankful for all the great services that are provided, because without that, I think our seniors would really not be able to live the type of lives that we really want them to live, where we're keeping them out of institutions, where we are trying to keep them healthy and keep them safe. And I keep saying safe because so many of our seniors are not that safe. One of the things I wanted to talk about, as I said, we're very fortunate in the practice that we work in to have the care coordination that we have. And so we have our social workers and our care coordinators who are so well knowledgeable about what's out there. But there are a lot of practices out there where they're single practitioners. And a lot of these services are great if we can get the people to the services. And sometimes I feel that maybe as a physician, I don't necessarily get a lot of notifications. I may know where to find some of this information, but in general, physicians don't necessarily know how to get this information. They may have clients that need some of these services, and they may not be completely well equipped. And things are changing so much all the time with all these new services out there. Trying to figure out a way that may be a good median to kind of get this information to single providers, smaller practices, that would really help bring the client and the services to each other. And that continues to be a huge issue, I think, overall. Different ways, listservs or mailings out there or websites, which are good, but again, it's interesting because we're in the geriatric field that we know a lot of this information, but patients who are, physicians who are seeing a patient every 10 minutes and are seeing patients of all different ages don't necessarily have this access. They don't have the time to do that. But if there was some kind of median, I think it would be extremely helpful and useful. But we've done very well. Overall, I think with all the federally and state funded programs, there is this great push to have seniors healthier, safer, and we're doing a great job, and things are definitely much better than they were even 5 years and 10 years ago. So we're definitely making progress. But I think our goal, like everyone else's, are to have more of these patients that we can take care of and fulfill. I loved your picture at the end. And those are our patients. Those are our grandparents. They're our parents. They're our neighbors. They are people that this is why we're doing them for. And it's important because we want to keep this part of our community alive as best as we can. I wanted to thank the fund for having everyone here today. I think this is very, very important. We need to continue to provide these services and take care of these patients, and actually bringing these patients to us all is very, very important. So thank you for having me. Thank you.